Assalamu alaikum viewers, this is Dr. Khawaja Sajid Aslam with the program Bone and Health. I'm an orthopedic surgeon. I do hip and knee replacement, primary and revision surgeries. Today I'm talking about total hip replacement. We did a couple of programs earlier about the hip arthritis. So most of the time this kind of procedure is required or is indicated in case of arthritis of the hip, or sometime in fracture as well. We'll just confine our discussion about the total hip replacement, how we do and what are the benefits of this kind of procedure and what are disadvantages. Total hip replacement is we replace the joint, we make a new joint, new full joint of your hip. How I perform this kind of surgical intervention, this kind of operation may be different than others, as every surgeon has their own protocols. I perform this procedure under spinal anesthesia. You get injection in your back, and from umbilicus downward, you don't feel anything. You are awake during this procedure. We don't give general anesthesia. We don't insert any tube in the mouth. If someone doesn't like the noise or they don't feel comfortable, we just give them IV injection and they just sleep. It's almost 1 hour procedure. We keep you on the side. It's around 10 to 15 centimeter cut on the side of your hip. We remove the ball of your hip, the femur head. We remove it, make a new metallic one inside, and the cup, the acetabulum, we rub it off and insert the plastic one over there. It's almost 1 hour procedure. The same day you get the procedure, 6 hours after the operation, I let my patients walk full weight bearing with a walking frame with the help of physiotherapist. And after a couple of days, most of our patients, they go home. It's very simple procedure, nothing to worry about. If you're orthopedic surgeon, if you're hip and knee replacement surgeon, suggest you to go ahead for such kind of operation, go ahead. What are the benefits of this procedure? Why shall you go ahead for surgical intervention? The single most benefit for joint replacement, either is a knee or hip, is the pain-free joint from day one. The arthritic pain, what you used to have over the years and years, that is completely relieved, completely gone on the day one of your procedure, day one of total hip replacement. Later on, what pain you will have is operative pain, which you can have after any surgical intervention of any other operation. After a couple of weeks, gradually, slowly it wean off, and then you don't need any painkillers. After this procedure, you can walk. You can walk kilometers and kilometers, pain-free, without any medication, without any painkillers. That's the most beneficial thing for this kind of procedure. When you walk, then your weight is balanced. Then your chances of diabetes mellitus, hypertension, cholesterol, cardiac problems, the chances of all these diseases goes down, becomes minimal. The problem with this arthritis of the hip, problem with the hip joint, if you don't go for the total hip replacement, patient cannot walk. If patient cannot walk, then gradually they start gaining weight. If they are diabetic, it becomes uncontrolled, hypertension, cholesterol, cardiac problems. The chances of all these problems gradually increase and increase. If you get the total hip replacement, you can walk and then you can live healthy life. Believe me, it's a life-changing procedure. And you will be surprised to know that the total hip replacement have 15% better results as compared to knee replacement as far as patient satisfaction is concerned, all these scenarios, pain and mobility and patient satisfaction. So 15% is better in hip replacement as compared to knee replacement. So it's a life-changing procedure, is a simple procedure, is a wonderful procedure. You shall go ahead for that and nothing to worry about. There are some problems related to this procedure. For example, wound can get infected, around 1% chances, like any other procedure. Blood can clot in the leg veins, called DVT, deep venous thrombosis, can be fatal as well, can go into lungs, it can cause pulmonary embolism. But to minimize this thing, we give the blood thinning medication for 35 days after the operation. There are certain precautions for this procedure, which your orthopedic surgeon, hip replacement surgeon can discuss in detail with you. All I mean to say, to do this awareness program, public awareness program, is to aware of those people, to create the awareness in those people who are scared of this kind of procedure, who thinks that the hip is not for surgery. But believe me, it's a life-changing thing. It's a wonderful procedure, and it's common all over the world. If you go to Europe, America, it's one of those common procedures for the hip or knee replacement. Asian countries, because it's introduced quite later, many people who were not trained here, or many people who came from overseas trained, and then they introduced this kind of procedure here. So now it's getting a little bit popular, and awareness programs like this program, what we are doing, or many other doctors does a public awareness program in social media, that have created awareness among the people that we shall go ahead for this kind of procedure. But believe me, it's a wonderful procedure. It's a life-changing procedure. If your orthopedic surgeon, especially the hip surgeon, the one who is performing these kind of surgeries and who is qualified, if he's suggesting you shall go ahead for this. I do the hip replacement and knee replacements as well. On display is my contact number. If you want to discuss or if you want to get appointment, you are most welcome. Thank you.